What makes for quality care at a hospital? The list is almost endless, but one crucial area is preventing errors and keeping patients safe. So how do you begin to do that? Dr. William Annable has joined us in the UH Broadcast Center to tell us. Dr. Annable is the Chief Quality Officer and Director of the UH Quality Institute, as well as Chief Medical Officer at University Hospitals. So welcome to our show.
Thank you very much for inviting me.
Everybody makes mistakes, but we tend to feel like medical staff has to be perfect.
True, everybody makes mistakes, and that's what's behind what we're trying to do. The trick is to have them come forward and let us know what those mistakes are when they're small before they become large mistakes.
Yeah, then you can fix it.
And you can fix it, exactly right.
So how do you make that happen in a hospital setting?
Well, it's a journey. It doesn't happen overnight. In this institution, we have one of our component hospitals that has made that journey, still on it, but 5-6 years into it. The rest of us have been into it a few months. It's called the Journey to High Reliability. High reliability is the answer to the equation of mistakes and what we do to correct them. There are high reliability things out there, airplanes, nuclear industry, but medicine is way more complicated. And that's what we are attempting to do.
Okay, and you said something also to me earlier about a just culture.
Exactly. One of the reasons that people don't come forward with their mistakes, small as they may be, is because they're afraid of punishment. So behind all of that, we have to build a just culture, which means that we approach everybody not just that they're innocent, but understanding all of the circumstances, and we try to find the balance between blamelessness and when it's truly egregious. It's also true that most mistakes that are made are not due to the person, even though the person was the one who carried them out. It's due to the system that we built around them. So we look for system errors that we can correct.
Okay. So do you have some examples of how you put these concepts into action?
Sure. We have a number of tools. One of them is ARC. It stands for ask, request, and concern, and then shame. And what it means is if you see somebody doing something wrong, like not washing their hands, you ask them a question. Do I need to remind you that you need to wash your hands? And if that doesn't work, then you go to the next step. You can say, if you move up to step 3, I have a concern that you're going to cause an infection to the patient in that room if you don't. And of course, the last step is moving up the chain of command.
Okay. And that works, right?
It does work, absolutely.
So do you have an example of how that worked in practice?
Oh, sure. In fact, we collect examples of it because they're usually good catches that stop something from happening that shouldn't have happened. One of my favorite stories is someone in EVS, our environmental worker, who was cleaning the area and saw a very senior attending about to enter a room without washing his hands, and she said, "Excuse me," and did the ARC routine, and he said the only thing he's allowed to say under our high reliability, which is "thank you." Washed his hands and went back in. So yes, it works.
All right. So what other tools do you use to encourage transparency?
Well, there are many. First of all, people who we're encouraging to be transparent have to trust us. That's what the just culture is all about. But there are many, many others. We have a thing called leadership rounds, leading to influence. Each of us in the senior leadership group is assigned 2 floors. We round on them several times a month. And people learn to trust us. First time I went there, they all disappeared, wondered what was wrong. As they learn that we're there to really help them and understand their problems, that works quite well. So that's another tool. We have a daily safety call. Where it varies, probably 30 or 40 of us are on the line together. We talk about what's happened in the past 24 hours, what we might anticipate for the day, and it can be anything having to do with safety. It can be as mundane as it's slippery on the front walk, be careful, to something that's happened on a floor that we need to correct right away.
Okay.
So also a good thing. The big principle is deference to expertise, which means we listen to anybody who can help us. It's not just the doctor who knows, it's just not the nurse who knows. Many times the expert is the patient themselves, or it's a family member. So that's critical. And the best thing we have here, as I mentioned before, is Rainbow's already been on this journey, and we use their safety coaches and experts to teach us. So,
okay. And they've been doing really well with it, right?
They've been doing extremely well. They've had 2 365-day intervals with no serious safety events, which is truly astounding.
Yeah, that's amazing.
It's not happened in any other children's hospital in the country, so they're justifiably proud of it, and we all are.
All right. Great information. Quality care includes constant improvement and recognizing, reporting, and solving issues is the key to its success. My thanks to Dr. Annabelle for sharing his and University Hospital's commitment to creating the highest quality care possible for patients.
For more information, call the Center for Lifelong Health at University Hospitals at 844-312-LIFE. That's 5433. Or visit www.uhhospitals.org/lifelonghealth.